Snoring is a very common problem, and almost all of us do it at some point under the right circumstances, and it just happens. It can occur in deeper stages of sleep. It can occur when we're having allergy problems or a cold, and that's okay. So how do we know when this is a problem? Well, snoring is related to some sort of partial blockage of the airway, either in the nose or nasopharynx, or in the back of the mouth, the oropharynx. And again, allergies and colds and things will cause this. It can become a problem when this obstruction is greater and due to excess tissue or excess weight, and it's causing us to have to wake up to clear our airway because we stop breathing. And when this happens, this is a condition called obstructive sleep apnea. These little stoppages in breathing, which makes us wake up to reestablish our airway. These episodes can happen 40, 50, 60 times an hour. And as you might imagine, this does not lead to very restoring sleep, and it can cause other problems. It can cause high blood pressure, fatigue, weight gain, and even heart failure. So it's something that we need to look into. So how do you know if your snoring needs to be checked out? Well, if it's particularly severe, if someone is observing you stopping breathing during sleep, if you are waking up with headaches in the morning, if you feel tired when you wake up in the morning, if you feel fatigued during the day, these are all things that might indicate that your snoring is more than just something annoying the person down the hall. So you need to talk to your doctor about it. Let him or her know that it's becoming a problem, and there are tests that can be done. If you do have sleep apnea, treatments are available. The most common one is a device called CPAP, which is worn while sleeping. Other options might include surgery or even a dental appliance that can be worn while sleeping and might be beneficial.